Good morning, my dear students. On the occasion of the COVID, today our concept is joints and its classification. Look at this. There are 300 joints in the human body, and all the 206 of bones are forming 300 joints. First, let us see what is the joint. Joint is defined as a functional junction between two or more bones is called a joint. Functional junction, that means the two bones are connecting at a point for maintaining its function. That is called a joint. So, two or more bones connecting each other for achieving its purpose. That is called a joint. So, the functional junction between two or more bones is called joint. Let us see the classification. The main function of the joint is mobility and stability. Certain joints are made for only stability, and certain joint means for stability and mobility, both the functions. Suppose if the joint is completely an immobile joint, then it is called as sinoarthroidal joint. For example, all the joints of the skull. These are the sinoarthroidal joint. There is no movement in the skull joints. And secondly, amphiarthroidal joints. If at all there is slight movement in the joint, then it is called as amphiarthroidal. Just look at here, the sternocostal joint is an amphiarthroidal joint. For example, when you are inspiring the air, the sternum moving upwards, expiring, the sternum moving backwards. So this kind of movement is taking place at the sternocostal joint. This is amphiarthroidal joint. A slight movement is possible. And third one is the diarthroidal joint. If there is free movement possible in the joint, if the joint is moving freely, then it is called as diarthroidal joint. Just look at here, this is the shoulder joint, it is moving very freely. Flexion, extension, abduction, adduction, rotation, all the movements possible in this joint, so that it is diarthroidal joint. This classification is based on its mobility, but based on its structure, the joints are classified into three different categories. One is the fibrous joint, second one cartilaginous joint, third one is the synovial joint. Fibrous joint. This classification is based on the connective tissue which is connecting the bones. Fibrous joint, the bones are connected by fibrous tissue. For example, sutural joints. Let's look at this. Here we have the sutures. This is sagittal suture, lambda suture, likewise. Here also we can see the sutures. This is the frontal bone and this is the parietal bone. These two are frontal and parietal are connected by the lambda sutures. So likewise, in sutural joints, the two bones are connected by fibrous sutures. And second type of fibrous joint is the gum process or peg and socket joint. Here, one articulating surface of the joint is like a socket, another peg-like articulating surface is fitting into the joint. See here, dentoalveolar joint, the joint between the tooth and the gums. The tooth are fitting into the gums. This is called as dentoalveolar joint, and also the gum process, the joint between the gums and the teeth. So here there is no movement possible in this joint. It is purely a sinoarthroidal joint. So until unless there is a pathology, there is no movement takes place in this gum process joint. Third one is the sutural joints, gum process, syndesmosis. Desmo means a fibrous band. If at all two bones are connected by fibrous band, then it is called as syndesmosis. The example of syndesmosis joint is the joint between the radius ulna, inferior radioulnar joint. This is the radius and this is ulna. So this joint. So this is the anatomical position of this part. So this is the radius, this ulna, the joint between inferior radioulnar joint. This is the radius and this ulna, the joint between the radius and ulna. This is called as syndesmosis joint, and slight movable joint. It is slight movement is possible. That is supination and pronation movement possible in this joint. And second type of joint is the cartilaginous joint. If the two bones are connected by means of the cartilage, then it is called as cartilaginous joint. So the cartilaginous joints are again classified into different kinds. Number one is the synchondrosis. Chondro means cartilage, syn means connection. See, look at this here. This is the rib. This is the sternum. Here we can see the cartilage, light yellow color. So the rib is connecting with the sternum by means of the cartilage. So this is called as synchondrosis. Chondro means cartilage, syn means connection. The cartilage is connecting two bones, then it is called as synchondrosis. Likewise, there is one more joint in the cartilaginous joint, that is symphysis. Symphysis means here also it is a type of cartilage joint, but two bones are connected by fibrous disc, then it is called as symphysis. Look at this. This is the hip bone, right ilium, left ilium. This part is called pubis. So the two pubis, they are connected by a disc, cartilaginous disc. This is called as symphysis pubis. So this is one kind of cartilaginous joint. Here also slight movement possible in this joint. It is a amphiarthroidal joint. Next, third type of joint is the synovial joint. The synovial joint is the most popular joint. All the movements are possible in this joint. It is the diarthroidal joint. It is very flexible joint in the body. So the synovial joint again classified into different kinds. Number one is the pivot joint. Look at here. This is the atlas. This is the axis. The joint between the first and second vertebra. This is atlantoaxial joint. The joint between the atlas and the axis. This is the atlas. This is the axis. The axis is fitting into the atlas. So this is atlantoaxial joint. This is pivot joint. So rotatory movements are possible in this joint. Look at this. Nodding of head. Rotatory movements are possible in this joint. It is a type of synovial joint. And next, coming to the other type of joint is the ball and socket joint. Look at here. So this is a round head of the humerus. This is a linoid cavity of the scapula. One articulating surface is just like ball. This ball-like articulating surface is fitting into the socket, so it is called as ball and socket joint. So the ball and socket joint is the shoulder joint and also the hip joint. Look at here, it is very prominent. The round head of femur fitting into the fossa of the hip. So this is called as a type of the ball and socket joint, and all the movements are possible in this joint. Look at here, flexion, extension, abduction, adduction, rotation, all the movements are possible in this joint. It is freely movable joint in the body. So if there is no ball and socket joint, you cannot perform the daily activities. Next joint is the hinge joint. Look at this here. So this is the humerus, the lower end of the humerus. This is olecranon process of ulna. This olecranon process of the ulna is making articulation in the lower end of the humerus. So here it is forming the joint is called elbow joint. So look at here, when we are flexing the joint is getting opened, and when we are extending the joint is getting closed. So this action is just like the hinge of the door. When we are pushing the hinge, the door gets opened. When you are closing the door, the hinge is holding the door. So likewise, when we are flexing the joint gets opened. When extending the joint gets closed. This type of joint is called as the hinge joint. Example is the elbow joint. And the hinge variety, there is a modified hinge variety. This is the knee joint. Knee joint is nowadays it is called as the modified hinge variety. Here also the joint works just like the hinge. If we are flexing, the joint gets opened. When we are extending, the joint gets closed. So that knee joint is also a type of the hinge joint. Next is the plane joint. Here the articulating surfaces of the joint are very plain. So example, intercarpal joints, these articulating surfaces are very plain, there are no ridges and edges, so that this joint is called as the plane joint. Example, intercarpal joints, the joint between the carpal bones. Next is the condyloid joint. So here the concavo convex articulating surfaces are forming the joint, then it is called as condyloid joint. So this is a brief classification of the joints, and still in depth we will see in the next class.